A special report on the families hoping for answers from an inquiry into the deaths of hundreds of mental health patients in Essex. Over the past 20 years, 2,000 people are believed to have died either whilst being cared for in mental health institutes in the county or within 3 months of being discharged. On Monday, a long-awaited public inquiry into these deaths and how to prevent more will begin. It could bring in major changes in mental health care, not just in Essex, but across England's NHS. Ahead of that, Charlie Frost has been hearing from former patients who say they were failed by those who were supposed to be looking after them. And she also spoke to the mother of one young man who took his life shortly after being discharged. And a warning that you may find parts of this report upsetting.
They were very close. There's only 16 months between the two boys. So yeah, it's 4 years and 4 days. So should be his birthday on the 23rd of September.
Carole's youngest son, Lee, took his own life in 2019, just months after leaving an Essex mental health unit.
What did the note say?
It said, "I love you so much, and I'm sorry." And Mum, so it was to me. We had to bury him the week after his 21st. Well, the first thought is, he should be here, he should be with us, he should be enjoying this with us. And he's missed everything. And he might have, if he'd have got the help that he asked for, he might be here.
She says Lee was promised therapy and a support worker in the community, but despite her calling the service weekly, it never materialised.
And then obviously 27th of August was when he wasn't here. So that day I called them and said to them, "You can take him off your books now." And within half an hour they were on the phone to me apologising, and I've got a letter dated that day, I think, in my books, or the day after, trying to sweep up the problem.
But the problem hasn't gone away. Carole's experience will soon become evidence in a public inquiry into how 2,000 patients died under the care of mental health services in Essex over the last 20 years. Responsible for those services is the Essex Partnership University NHS Foundation Trust. It runs 35 adult inpatient wards and 3 for children and teenagers across the county. 3 years ago, it admitted to failings that led to 11 people taking their own lives on its units. 4 of those happened within these walls at the Linden Centre in Chelmsford.
You should be saying I'm lucky that I got the mental health support I needed at the right time. But no, I'm lucky I survived the Linden Centre.
Within 3 weeks of being admitted, this woman says she was raped by a fellow patient. As a victim of sexual assault, we're protecting her identity.
I can remember at least 2 other occasions during my time on the ward where other women were raped. We were certainly not kind of kept safe from one another or from ourselves. I think in my case, I don't blame the patient who raped me. He was unwell. I blame the staff who weren't able to safeguard me.
She says the treatment was cruel, staff taunting patients, and the ward was dangerous, those being paid to care for her, distracted or asleep.
So you were there because you were suicidal, yet you were able to try and take your own life while people were watching you or supposed to be watching you?
Yeah, I managed to abscond from the ward a couple of times. Once I took a very serious overdose. But as I say, it was a very chaotic environment. It wasn't structured towards people becoming well. It was like you were contained in this pen and people didn't really know what was going on.
Families have been fighting for this inquiry for almost a decade. Now, nearly 4 years since it was first ordered, it will finally begin. But concerns continue to be raised about the trust. With one mum whose daughter is currently being treated at this mental health unit in Colchester, sending me these photos which appear to show staff asleep. She says they were supposed to be on suicide watch, watching her daughter 24/7, and because they weren't, her daughter was able to harm herself. In a statement, the Trust's chief executive urged anyone with concerns around their care to contact them, adding, "We know how painful this time will be for those who have lost loved ones, and our thoughts are with them. We will continue to do all we can to support Baroness Lampard and her team to provide the answers that patients, families and carers are seeking."
I don't want any other family to go through what we've been through. If one of my grandchildren need help when they're older, hopefully if they ask for help, they'll get it. Things need to change.
And that's what it's hoped this inquiry will bring: truth and change.
Charlie, clear from your report there that this has been just a long and painful fight for all those families.
Yes, and for many, it's still ongoing. Let's not forget that this inquiry was first ordered 4 years ago. Now, I've looked at coroners' reports, and in that 4 years, coroners have written to the Trust 14 times, demanding urgent action is taken to prevent future deaths. That's 14 more families that have lost loved ones. Now, I've been covering the apparent crisis in Essex mental health services for 5 years now. And I have to say, despite the relentless campaigning from families, it did feel at times that they may never get this far. The cusp of a public inquiry, the first of its kind into mental health, will begin on Monday. And despite it being ordered by the last government, the Health Secretary has told me that he is supporting it, and he will soon meet with some of the families to hear their experiences. So it's hoped that finally some lessons may be learned from these 2,000 deaths in Essex that may hopefully improve mental health services across the country.
Absolutely. Charlie, thank you.